Hello everyone, my name is Dr. Lilian Werimo Moko. I am an ENT surgeon specialized in neurotology and cochlear implant surgery, practicing at Kenyatta University Teaching Referral and Research Hospital. So, otology is a subspecialty of ENT where one specializes in the ear only, and not just ear but also ear and hearing care. So what this comprises is ear disease and hearing loss, and also looking at care and rehabilitation of people who have deafness or people who have severe forms of hearing loss. So hearing loss in children is quite detrimental because when a child has a hearing loss, they have difficulty acquiring language and speech, which is very, very important in their school, especially in learning for educational purposes and even for social integration. So when a parent is having a child and they're not sure if they have a hearing loss, there are some clues that children give as they are growing up. One, if you have a very quiet child in their infancy, so you find that your child can sleep through all sorts of noise, they are not irritated or rattled by it, that could be a signal that your child has a hearing problem. The biggest is delay in speech. By the time your child is 9 months old, they should be able to at least say mama or dada or baba. And if you find that your child is late in terms of speech, you should take them to hospital to be screened for hearing loss. And finally, any child who has an ear deformity, any child who has discharge from their ears, or any child who has high fever with recurrent tagging of the ear or complaining of ear pain, that is a child who could easily develop hearing loss, and those are the children that we should bring to hospital for screening. Over and above all, given that hearing loss is an invisible disability, any child, whether they look normal or not normal, should have their ears screened to make sure that they have normal level of hearing. Half of the hearing loss is caused by genetic causes, and half of the hearing loss can be caused by environmental causes. Environmental causes being things such as noise, exposure to medication or chemicals, exposure to recurrent ear infection. Some of those are the ones that cause hearing loss that can be prevented. So those are the ones we call preventable causes of hearing loss. Now when you look at the genetic now is an irreversible or a permanent cause of hearing loss. Generally, SHA covers patients in two categories. We have the comprehensive cover, and we have, that is for the civil servants and disciplined forces, and also for the teachers. Through that package, SHA will be able to cover for you to have your ENT clinic reviews, to have some audiological test reviews, and to also have the whole comprehensive surgical care, that is comprehensive surgical ENT care. For the general SHA, it will be able to cover for you under the surgical package. It will cover for you all the surgical expenses for ENT procedures, and also under the emergency cover, it can cover for you all the emergency procedures, emergency ENT procedures that you would require in a hospital. So on March 3rd is World Hearing Day. This is the day that we take to celebrate and to promote ear and hearing conditions, and to also promote people with deafness or people with hearing loss. So as KUTRRH on this day, based on the theme from communities to classrooms, we are focusing on children. If you have children who are 14 years and below and they could be having a hearing loss or could be having a hearing problem, on 10th of March we welcome you to come. We will be offering free screening services, and as an organization, as a hospital, because we love and value our children, we are going to the schools and we are spreading a message on safe listening practices. We have noted that we have a lot of music that comes from the matatus. We have a lot of noise that comes from the juakalis. Our children are playing a lot of video games and a lot of phone games. And secondly, we urge the public to adapt safe listening practices. Keep your volume below 60% of your device. Listen or limit listening to very loud music to 60 minutes. That is the 60-60 rule. So we want to encourage, and we will ask you to encourage children and any other person that is exposed to very loud noise to come to hospital for screening. We wish you a happy World Hearing Day. Take care of your ears, practice safe listening for a better and a clearer future where you connect with your world.